Like, share, comment, and subscribe to get alerts for new videos. Dialysis is more than a routine. It's a life-sustaining therapy for patients with end-stage renal disease. But did you know that the way we access the bloodstream through an arteriovenous fistula can directly affect how effective dialysis is? Evidence-based practice means using the best available research to guide clinical decisions. A 2022 multi-center study by Ozan, Aydin and Sayalan provides compelling evidence that AV fistula cannulation technique plays a critical role in dialysis adequacy. The study followed 385 patients across multiple dialysis centers and found a statistically significant relationship between cannulation practices and dialysis adequacy, measured by KTV and urea reduction ratio, URR. Patients who received consistent protocol-driven cannulation, especially using the rope ladder technique, showed higher dialysis adequacy scores. In contrast, poor technique, frequent infiltration, and inconsistent site rotation were linked to lower KTV values and increased complications. The authors concluded that appropriate cannulation technique is essential for maintaining vascular access and achieving adequate dialysis. This reinforces the need for standardized training and adherence to best practices in AVF cannulation. Training dialysis staff in evidence-based cannulation protocols, such as proper needle angle, site selection, and recognizing signs of access dysfunction, can lead to measurable improvements in patient outcomes. When AVF cannulation is done right, patients experience better clearance of toxins, fewer missed treatments, and improved quality of life. The evidence is clear. Dialysis adequacy begins with how we cannulate. Let's commit to excellence in every needle stick, because our patients deserve nothing less. Dialysis is more than a medical procedure. It's a partnership. And how we access the bloodstream through an arteriovenous fistula can directly impact how effective dialysis is. A 2022 multi-center study by Ozan, Aydin and Sayalan revealed a clear connection between AV fistula cannulation practices and dialysis adequacy. The study followed 385 patients and found that proper cannulation technique, especially consistent site rotation and adherence to protocols, was associated with significantly higher KTV and URR scores. Techniques like the rope ladder method reduce complications like infiltration and aneurysm formation. But here's the key. Dialysis adequacy isn't just the responsibility of the clinical team. It's a shared responsibility, and the patient plays a vital role. Patients must be empowered to advocate for their vascular access. The study emphasized that patients who were informed, engaged, and proactive about their cannulation experienced better outcomes. KTV is a simple way to measure how well dialysis is cleaning your blood. Think of it like a score. The higher the number, the more waste is removed. For most patients, a KTV of at least 1.2 is considered adequate. It helps doctors know if your treatment is working well. Urea reduction means how much of a waste product called urea is removed from your blood during dialysis. A URR, urea reduction ratio, of 65% or higher is generally considered good. Lower urea in your blood after treatment means your dialysis is working and keeping you healthier. Fistula cannulation is how needles are placed into your access site for dialysis. Good technique helps your fistula last longer and keeps treatment safe. The rope ladder technique means using a different spot along your fistula each time. This spreads out the needle sites, helping to prevent damage and keep your access healthy. The buttonhole technique uses the exact same spot for each needle, creating a tunnel under the skin. This can make needle sticks less painful, but needs careful care to avoid infection. As a patient, your role includes monitoring your fistula daily for changes in thrill or bruit, reporting pain, swelling, or signs of infection immediately, asking your nurse about the cannulation technique being used, requesting site rotation to prevent repeated trauma, participating in education sessions about AVF care. The authors concluded, Patient education and involvement in cannulation practices are essential for maintaining vascular access and achieving adequate dialysis. This isn't just good advice, it's evidence-based practice. When patients are informed and involved, they become powerful advocates for their own health. Better cannulation means better dialysis and better quality of life. Let's commit to excellence in every needle stick, because dialysis adequacy starts with access, and access starts with you. If the fistula fails or becomes unusable, your care team may recommend angioplasty or surgical revision, switching to a graft or catheter temporarily, or creating a new fistula in a different location.